we are diving into a subject that many of us think about but often feel hesitant to discuss: hair loss itself. Individuals enjoy thick, healthy hair throughout their life, while others begin to notice their hair loss in their 20s and 30s. Factors such as stress, lack of sleep, poor nutrition, and underlying health conditions like thyroid disorder can exacerbate hair loss. If you start noticing that your hair is shedding more than it's growing back, and if your hair appears noticeably thinner, it's time to pay attention. Early detections can lead to positive outcome with the right care and intervention. Today, we are diving into a subject that many of us think about but often feel hesitant to discuss: hair loss itself. Individuals enjoy thick, healthy hair throughout their life, while others begin to notice their hair loss in their 20s and 30s. Factors such as stress, lack of sleep, poor nutrition, and underlying health conditions like thyroid disorder can exacerbate hair loss. If you start noticing that your hair is shedding more than it's growing back, and if your hair appears noticeably thinner, it's time to pay attention. Early detections can lead to positive outcome with the right care and intervention. Everyone, welcome to the Anna Hu channel Facebook Live session. This is a space dedicated to sharing knowledge about health and aesthetic medicines. I'm Dr. Anna Hu. Today, we are talking about a topic I'm sure many of you can relate to: hair loss. Some people say hair loss is a sign of aging, while others think it's something only men face. But in reality, more and more young people, including women, are experiencing hair loss. Have you ever looked into the mirror and noticed your hair parts getting wider? Or during your shower, notice more hair falling onto your hands or the floor? Even after trying various anti-hair loss shampoo and tonic, the problem still persists. Don't worry, today I'll break down and answer all the common questions about hair loss so that you can understand what's really happening. Before we begin, I would like to ask a quick question. In the past 3 months, have you noticed that you are losing more hair than usual? If yes, type yes in the comments. If no, type no. Let's see how many of you are experiencing this issue during today's live session. And to make it more fun, we are giving away our complete essential kits to 5 lucky viewers who join in and ask questions during the sessions. What's inside this amazing kit? An amount, which will help to boost energy and support cell repair. Collagen forte, which will help to improve skin elasticity and radiance from within. Plant Pro Plus enhances gut health, daily nutrition, and overall wellness. It's an easy way to help you look better. So don't be shy. Drop your questions about hair loss in the comment below. We'll announce the winner tomorrow on the Anna Hu channel Facebook page. So be sure to like and follow us. Okay, let's start by watching a short video together to understand what exactly is hair loss and what causes it. Today, we are diving into a subject that many of us think about but often feel hesitant to discuss: hair loss itself. You might be wondering why some individuals enjoy thick, healthy hair throughout their life while others begin to notice their hair loss in their 20s and 30s. The core player in this process is a hormone byproduct called DHT or dihydrotestosterone. To visualize this, think of hair follicle as little flower pot nurturing vibrant hair growth. Under normal conditions, this pot thrive and produce strong hair. However, when DHT levels are elevated, or if hair follicles are genetically predisposed to DHT sensitivity, it's as if a layer of concrete is slowly covering this pot. Initially, the plant or your hair can still flourish, but as this cement thickens over time, the pot shrinks, becoming weaker until they can no longer support new growth. This gradual process leads to noticeable changes in hair density and overall appearance. But why are some people more sensitive to DHT than others? That mainly boils down to genetics. If hair thinning is prevalent in your family, your likelihood of experiencing it increasing. Moreover, your lifestyle choices play a vital role in hair health. Factors such as stress, lack of sleep, poor nutrition, and underlying health conditions like thyroid disorder can exacerbate hair loss. Imagine those flower pots without sunlight and nutrients, they will weaken even more quickly. It's also important to note that men and women experience hair loss differently. Men often notice a receding hairline and thinning at the crown, forming distinctive patterns. In contrast, women typically experience overall thinning, particularly widening at the part line, while the front hairline remains relatively intact. These differences arise from hormonal variations and the way various follicle zones respond in men and women. To summarize, hair loss can result from the shrinkage of the hair follicle influenced by DHT in cases of male pattern baldness, with genetics determining the sensitivity of those follicles. Additionally, lifestyle factors significantly impact how quickly hair thinning occurs. Welcome back to the Anna Hu channel. If you have any questions about hair loss or thinning hair, feel free to leave them in the comments. We will be giving away our complete essential kits to 5 lucky viewers who joined in and asked questions during these sessions. What's inside this amazing kit? 5 sachets of an amendment, which will help to boost energy and support cell repair. 4 sachets of collagen forte, which will help to improve skin elasticity and radiance from within. 3 sachets of Plant Pro Plus, which will enhance gut health, daily nutrition, and overall wellness. It's a simple way to help you look better, feel stronger, and glow with confidence from the inside out. Now, let's start with the basic. What exactly is hair loss? And what does it really mean when we say someone is experiencing it? In medical terms, hair loss is called alopecia. It can be temporary or permanent. Hair loss may show up as hair becoming thinner or sparser, or it can develop into patchy areas. In severe cases, it may lead to complete hair loss in certain regions. Many people often ask, how do I know if I'm really losing hair? Here are some signs to watch out for. increasing shedding when washing or combing your hair, you may notice handfuls falling out, sometimes more than 100 strands a day. Widening hair parts or more visible scalp if you notice more scalp showing than before. That's a warning sign. Changing in hair volume for women. The ponytail may feel thinner. For men, the hairline may gradually recede. Everyday hint, you might notice more hair on your pillow, in the shower drain, or on your clothes and shoulder. Here is a simple test you can try at home. The hair pull test. Gently grab a small bunch of hair and pull lightly. If more than 3 strands coming out, it could indicate abnormal hair shedding. So, what actually causes hair loss? The main reasons are a combination of genetics and hormones. Our body naturally produces a hormone called testosterone, which is normal and essential. But when testosterone converts into another form called DHT or dihydrotestosterone, that's when trouble starts. If your hair follicles are genetically sensitive to DHT, problem begins to appear. You can think of your hair follicles like the roots of a tree and DHT as mud. Under normal conditions, the roots absorb water and nutrition and the tree grows strong and healthy. But when too much mud building up around the roots which prevent them from absorbing the nutrition, it starts to block them. Over time, the root becomes weaker and thinner. Nutrients can't reach them, and eventually the tree starts to wither. The same happens to your hair. When DHT clogs the follicle, new hair grows thinner, softer, and eventually stops growing altogether. But it's not just about genes and hormones. Your lifestyle plays a big role too. Chronic stress and lack of sleep increases cortisol level, like adding fuel to a fire. This will accelerating follicle aging. Poor nutrition like lacking protein, iron, zinc, and vitamin D is like soil without fertilizer. Hair simply can't grow well. Smoking and alcohol will affect blood circulations, making it harder for nutrition to reach the scalp. Unhealthy scalp conditions like too oily, flaky, or inflamed will further weaken the follicles. Men and women also experience hair loss differently. Men usually notice a receding hairline or thinning at the crown, forming an M or O shape. Women typically see a widening part lines and overall thinning, but rarely complete baldness. This happens because DHT-sensitive receptors are distributed differently on male and female scalps. So in short, if you are genetically sensitive to DHT and on top of that have poor sleep, high stress, or an unbalanced diet, your hair will thin much faster. I'm sure many of you are wondering, if DHT causes hair follicle to shrink, why do some people lose a lot of hair while others seems unaffected? The answer lies in your gene. Not everyone's hair follicles are sensitive to DHT. Think of it like this. When a strong wind blows, some tree roots are so fragile they loosen easily, while others are firm and stay rooted no matter how strong the winds gets. The sensitivity of your follicles to DHT is largely determined by genetics. If hair thinning runs in your family, for example, your father, uncle, or grandfather all experience it, your follicles are likely more DHT sensitive too. That means you might start noticing hair loss as early as your 20s or 30s. On the other hand, if your family doesn't carry that trait, even with DHT in your body, your follicles may not react much, and your hair will remain healthy longer. In other words, DHT is like a spark, and your genes decide whether your follicles are dry grass or fireproof wood. If your follicles are flammable, DHT can damage them easily. If they are resistant, your risk of hair loss is much lower. If you have any questions about hair loss, drop them in the comments and I'll answer them one by one. And to thank you for your active participations, we have prepared a special gift for engaged viewer, the complete essential kits, which will be given to 5 participants who ask questions during these sessions. What's inside this amazing kit? Enamant, which will help to boost energy and support cell repair. Collagen Fortes, which will improve skin elasticity and radiance from within. Plant Pro Plus, which will enhance gut health, daily nutrition, and overall wellness. It's a simple way to help you look better, feel stronger, and glow with confidence from the inside out. So, don't be shy. Leave your questions about hair loss or thinning hair in the comments now. We'll select 5 lucky viewers for this exclusive diagnostic opportunity. Maybe the next lucky one is you. Alright, now let's move on to our second video, where we will learn how to assess the seriousness of your hair loss. Patients commonly ask, "Doctor, I'm losing hair. How do I know if it's serious?" First and foremost, it's important to know that losing around 50 to 60 hairs daily is completely normal. Just like trees naturally shed their leaves, our bodies go through a renewal cycle. However, if you start noticing that your hair is shedding more than it's growing back, and if your hair appears noticeably thinner, it's time to pay attention. Here are some common signs that may indicate a more serious issues. Your hair part may look wider, revealing more of your scalp. Your ponytail feels lighter or thinner than usual. You find clumps of hair on your pillow, in the shower drain, or on your brush. For men, a receding hairline or thinning in the crown may become apparent. Let's take a moment to categorize hair loss into temporary or permanent conditions. The most common type include androgenic alopecia, often referred to as hereditary baldness, affecting individuals of all genders. Alopecia areata, an autoimmune disorder that results in patchy hair loss. Collagen effluvium, characterized by a rapid shedding of hair, typically triggered by physical or emotional stress. Anagen effluvium, often associated with medical treatments like chemotherapy, which resulting in sudden hair loss. Individuals may experience hair loss in different ways. Receding hairline, common in male pattern baldness. Overall thinning, often seen in female pattern baldness. Patchy hair loss, small area where hair density suddenly drops. Loss of scalp and body hair, noting impact on both the scalp and body hair. These symptoms can indicate distinct type of hair loss. Genetic hair loss, the most common type, which is often gradual. Stress-related hair shedding, a response to significant life changes or health issues, though hair can regrow after recovery. Patchy hair loss, which is caused by an immune system response against hair root. Tight hairstyle, hair loss, damage due to prolonged tensions from hairstyle. Scalp damage hair loss, which resulting from inflammations or injury that may permanently affect hair growth. So, how do we determine how serious your hair loss is? For men, healthcare professionals or doctors often use the no-root scale, which classifies hair loss into 7 stages, from slight recessions to extensive thinning. For women, we utilize the Ludwig scale, divided into 3 stages. Number 1, slight widening of the part line. Number 2, noticeable overall thinning. Number 3, large area of visible scalp, while the front hairline remains intact. As you can see, hair loss isn't a one-size-fits-all condition. It varies in type and severity. Early stage hair loss generally respond well to treatment. However, if it progresses to an advanced stage where follicles are inactive, even advanced therapy may have limited effectiveness. Understanding which stage you are experiencing will empower your healthcare practitioner to recommend the most effective treatment plan tailored specific to you. Welcome back! If you have any questions or want to interact with me, go ahead and leave your comments below. The next segment will be our Q&A sessions. We'll be answering questions from viewer, but before we dive in, let's do a quick recap. How do we actually determine the severity of hair loss? A patient once asked me, "Doctor, how do you assess the severity of hair loss? Do I have to lose almost all my hair before it's considered serious?" Actually, not at all. In clinical practice, we look at a few key indicators. Number 1, hair loss pattern. For men, we often use the Norwood scale, which classifies hairlines, recessions, and thinning on the top of the head into 7 stages. For women, we use the Ludwig scale, which focuses on how wide the part line has become and how thin the overall hair looks, usually 3 stages. Think of it as a map showing how far the conditions has progressed. Number 2, amount of shedding. Losing 50 to 100 strands a day is normal, but if you are clearly losing more than that, for example, a handful every time you run your fingers through your hair, it's a sign to pay attention. Number 3, scalp conditions. Doctors check for signs of inflammations, redness, excessive oil, or scarring. A poor scalp environment can accelerate hair thinning. Number 4, diagnostic tools. Clinics often use magnifier or scalp scanner to observe hair follicles for miniaturizations. When hair becomes noticeably finer and thinner, it indicates that the follicles are weakening. In summary, doctor or healthcare practitioner assess the severity of hair loss by combining number 1, visual grading, number 2, amount of shedding, number 3, your scalp's health, number 4, imaging or follicle analysis. With these informations, we can design the most suitable treatment plan for each person. Different types of hair loss. Not everyone experiences hair loss for the same reason. By identifying the patterns and area of thinning, doctor can determine the type of hair loss, which helps target the right treatment. The most common type is milk pattern hair loss, mainly related to gene and hormones. Men, receding hairlines or thinning on the top of the head. Women's, widening part lines or overall thinning on the crown. The second type is stress-related hair loss. This can happen after going through major stress, illness, surgery, or a high fever. You might suddenly lose a lot of hair at once, but don't worry. It's usually temporary, and your hair will grow back once your body recovers. The third type is patchy hair loss. This is when your body immune systems attack your own hair root, causing round, bald spots to appear out of nowhere, which we call alopecia areata. The fourth type is hair pulling hair loss. This happens when you tie your hair too tight, like very tight ponytail, braids, or wearing tight hats or hairband often. The constant pulling can hurt the roots and make the hair fall out. The last type is scarring hair loss. It's quite rare and usually caused by serious scalp inflammation, infections, or injury. Once the hair roots are badly damaged, they can't grow back anymore. So, in short, not all hair loss is the same. Each type has different causes, and that's why the treatment needs to match the exact problem. Alright, let's move on to our audience Q&A segment. First questions. Since milk pattern baldness is related to male hormone, does that mean female hair loss has nothing to do with male hormones? Many people assume that milk pattern baldness only happens to men, but that's not true. Women can also experience androgenic alopecia, which we call female pattern hair loss in medical terms. The difference lies in how it appears. For men, it's usually more obvious. The hairline slowly recedes, or the top of the head becomes thinner, eventually form an M shape or O shape. For women, it's more subtle. The hair becomes thinner overall, especially along the parting line, which gets wider over time. However, the front hairline usually remains. So why does this happen? It's mainly because of the effect of DHT, dihydrotestosterone, on hair follicles. Men's hair follicles on the front and top of the scalps are especially sensitive to DHT, which make them more prone to balding. Women also produce male hormones, but their receptors are distributed differently, and estrogens offer some protections to the hair follicles. That's why women usually experience diffuse thinning rather than total baldness, especially after menopause. When estrogen level drop and that protective effect weakens, women's hair loss tends to be more noticeable. So, are the causes of hair loss the same for men and women? One of the causes are indeed the same. Things like genetics, hormones, poor nutrition, stress, lack of sleep, and thyroid issues can all affect hair follicles' health. But there are also differences. For example, for men, hair loss is mainly driven by the effect of DHT on the follicles, while for women, it's often linked to hormonal fluctuations like menopause or a drop in estrogen protective effect. So, to sum up, the common ground, genetic and hormones, are key. The differences, men and women have different hormone balances and hair follicle sensitivity. So, their patterns of hair loss look different. Next questions, doctor. I've often heard people say that wearing hats or using too much hairsprays can cause hair loss. Is that true? Or is hair loss mainly about hormones? And why is it that some people with similar lifestyle lose hair badly while others don't? That's a very common question. Actually, wearing hat or using hair product doesn't directly cause hair loss. At most, a hat might make your scalp sweat more or produce more oil. And if you don't clean it properly, that could lead to scalp irritation. But it won't kill your hair follicles. Hairsprays and styling products are the same. As long as you wash them off properly, they won't make you bald, except if you have scalp sensitivity. The real deciding factors are still your gene and hormones, especially DHT. If your follicles are genetically more sensitive to DHT, they will gradually shrink and weaken over time. That's why two people with similar lifestyle can have very different outcome. One loses hair easily, the other keeps a full head of hair. The key differences lies in their genetic makeup and how their follicle responds to hormone. So hat and hairsprays aren't the villains here. They might worsen scalp conditions if used improperly, but true hair loss still comes down to genetics and hormones. Next question, doctor, if hair loss is genetic, is there still hope? Does that mean it's impossible to reverse and I'm destined to go bald? That's a great question, and the good news is no. Genetic hair loss doesn't mean you are doomed to go bald. It's true that your genes determine how sensitive your hair follicles are to DHT, but that doesn't mean that there's nothing you can do. In the early stage of hair loss, the follicles are usually weakened but not dead. At this point, with the right treatment like topical minoxidil, oral or spray-based DHT blocker, plus nutrition support and scalp care, many people can regrow thicker, healthier hair. Even for moderate to more advanced hair loss, there are still effective options available. Treatments such as PRP, platelet-rich plasma, scalp nutrients injections, and low-level laser therapy can all help stimulate follicle regenerations. So yes, genetics play a role, but with the right effort and medical interventions, we can significantly slow down or even reverse the progressions of hair loss. In other words, your gene may determine your risk, but whether and how fast you actually go bald, that's still within your control. In the next segment, we'll be sharing more about different treatment options for baldness and hopefully bring new hopes for restoring a fuller, healthier head of hair. Okay, now let's continue to answer the questions. Look at the questions from Lina Tan. Dr. Anna, good evening. Taking your advices and took all supplements you recommended is brilliant, but you also tell us to exercise and must have enough sleep. Is there any more other advices? Good evening, Lina. I'm glad to hear that you're following the supplements. In addition to exercise and sleep, staying hydrated, managing stress, and maintain a balanced diet are also important. Most importantly, listen to your body and don't hesitate to reach out if you need more personalized advice. So I recap again. If you cannot remember it all, usually we have 6 things to remember. Number one, to reduce inflammations. Whichever things will traumatize the body, we stop doing it. Number two, prioritize your sleep. Getting enough sleep will allow the hair to grow faster and to grow better as well. Thirdly, hydrate your body well. Fourth, eat well, either from natural source of food or you can add it on nutrition supplementations. And exercise, not overdoing it. Observe how your body responds so that you can hit a balance on the input versus the output. Six, not to forget as well, to have a good peace of mind. Look at how you manage stress and then look at how you handle stress as well. Okay, now let's look at the other questions. Questions from Chin Chin. Okay, yes, my girl and boy aged 13 plus and 16 plus also have this problem. Yes, this is extremely common nowadays, especially in teenager. So hair loss in young girls and young boys can be caused by various factors, including most importantly, number one, it could be genetically inherited. So if they have a family history of hair loss, this can also play a significant role. Second thing, it's also very obvious because of hormonal changes. Puberty, menstruations, or conditions like polycystic ovarian syndrome. This is extremely common nowadays because the intake of sugars and carbs it's so much more compared to the previous generations. This can affect hair growth because it will change the hormone balance in the body. Next, potential cause it could be also because of nutritional deficiency as well. So lack of vitamins and minerals such as iron, zinc, and biotin can lead to hair thinning, especially iron in young girls because this is a period where they first attain menarche when they started to have menstruations. And the other reasons it could be because of stress induced, either emotional stress or physical stress. This can also trigger hair shedding. This will be particularly more obvious during the exam period. And most of the time, I do hear the parents say that I don't think they have any stress. The reason why is because they have enough food to eat, they have shelter, they don't need to worry about income, things like that. But for those young girl and young boy nowadays, their stress level, I would think that is not exceeding but as much as the adult as well because this is a period where they started to learn to interact, started to learn acknowledgement not only from external but also acknowledging themselves to learn who they really are and how are they going to manage or to connect with people around them. This can create certain amount of stress in them. And last but not least, which is the potential medical conditions. So conditions like alopecia areata, like patchy type of hair loss, thyroid disorder, diffuse hair loss throughout the whole scalp area, or autoimmune diseases, this can also result in hair loss. So if you notice that the pattern of hair loss is a bit worrying or a bit different compared to the common hair loss that you know of, please consult healthcare practitioners so that they will have a better assessment and we do not miss any any sign or symptom, and we can support their growth in a better way. Then let's see for another questions. Okay, now look at the questions from Wendy. So what are the best medical proven treatments for receding front hairline conditions on women? Okay, so receding hairline in women can be attributed to various factors, including it could be genetic, it could be hormonal, and it could be because of medical conditions. So treatments that have shown efficacy in addressing these conditions are like topical cream like minoxidil. So topical cream is minoxidil is FDA approved for female pattern hair loss, and it will help to stimulate hair growth and can slow down the rate of hair loss. So alternatively, to the other extreme, besides topical, we can also consider hair transplant surgery for those ladies who have extreme like receding frontal hairline. And hair transplant procedure can redistribute the hair follicle from the donor side at the back and then or at the side of the head to the area which is receding at the front area. And this will assist in reductions in the whiteness of the forehead, will give significant aesthetic corrections as well. Other treatments are like platelet-rich plasma therapy, where this technique, it will involve drawing a small amount of blood, process it, and then to get the concentrated plasma, which concentrated platelet, and then we will inject into the scalp. So PRP may promote hair growth by stimulating the hair follicle through the utilizations of growth factor. Other forms of treatments are like low-level laser therapy. This non-invasive treatment uses specific wavelength of light to stimulate hair growth and can be done at home with devices or in-office treatment. So the other potential cause of receding hairline in women are hormone imbalance. So if hormone imbalance is in the picture, hormonal treatment to balance back the hormone can be one of the treatment of choice as well. So conditions such as polycystic ovarian syndrome, or even more common is during menopause, or another more common conditions are post-pregnancy, especially after delivery, month 3rd to month 4th. This is the period where the patients will have significant hair loss. Not to worry, because eventually the hair loss, the hair will regrow again. So other conditions are like nutritional supplement, nutrition deficiency, which we can restore it with nutrition supplementations in women. The most common vitamins or mineral deficiency are like iron, vitamin D3, and biotin, not to forget of zinc as well. So deficiency of all these nutrients can contribute to hair loss. So supplements may help to improve the scalp health, and if deficiencies are present, the solutions is pretty simple, just to restore it. And it's essential for women experiencing a receding hairline to consult a healthcare provider or practitioner to understand the underlying cause so that they can treat the conditions in more personalized manner. So we have another questions here from Jeffrey. So my family gene naturally have hair loss when reaching like 30s. Can I prevent that? So if your family has a history of hair loss, particularly as you reach your 30s, there are several steps that you can take to potentially prevent or slow down the process. So start preventions early. That's the key. If you know that you have a genetic predispositions to hair loss, consider starting the treatments like minoxidil, topical minoxidil early. These may help in maintaining the hair density and to promote the hair growth. The other things are like make sure you eat healthily, ensuring that you consume a balanced diet which rich in vitamins and mineral, which is essential for health. Nutritions like what we have shared before, biotin, vitamin D3, iron, zinc, and not to forget as well, omega-3 fatty acid can be beneficial for hair growth. Next will be to get enough sleep and to avoid stress. High stress can contribute to hair loss. So engage in stress reducing activities such as exercise, meditations, or hobbies that you enjoy. The other important things is which we haven't discussed about, it's to talk about hair care. Try to use gentle hair care. Avoid too frequent of hair dye. So I noticed that some of my patients, every time after they color their hair, they do have experienced a period where they have a little bit more hair loss compared to normal. Not only about hair dye, the other chemical used to fix or to style the hair is also important. So try to use a gentle hair care product and avoid excessive heat styling or tight hairstyle and harsh treatments that can damage hair. So how do you know that whether the hair treatment is suitable for you or not? So without trying, we won't know. After trying, if you do notice that you have itchy scalp, or after trying, you do notice that you have slightly more hair loss compared to normal, then you might not wanted to retry that particular treatment again. So if you notice any signs of hair loss, consult a healthcare professional or practitioner for professional advice to understand the real cause behind your hair loss. They might suggest treatment like what we have discussed before, but the most important thing is to get to know what's the root cause of it. Then we can go to the next questions. Let's see. Okay, let's look at the next questions. So does frequent washing causing hair fall? Frequent washings of hair does not directly cause hair fall. However, it can contribute to hair damage and dryness, which may lead to breakage. Here are some factors that to consider regarding washing your hair often. Number one, whether the hair care product is suitable for you or not. So for those people who have sensitive scalp, so some of the chemical in the hair care product itself, likely the toner or the shampoo, it might induce scalp sensitivity, or we call the scalp dermatitis. So if you notice this type of situations, maybe you need to change to a milder form of hair care. So the other possible conditions are like what type of hair that do you have. So oily hair may benefit from more frequent washing to remove the excess sebum, while dry or curly hair might require less frequent washings to maintain the natural oils on the surface of the scalp and on the hair itself as well. And then please look at the shampoo formulations as well. Some shampoo contain harsh sulfates or chemical that can strip the hair of its natural oil, leading to dryness and breakage. So try to use a gentle hair care product. So I do have one patient that have frequent dermatitis or frequent allergic reactions. So after he trying high low, trying to search for the reason why he's having frequent allergic reactions, towards the end he noticed that the hair shampoo that he is using for the past so more than 10 years, so many years, it's actually the culprit. So the moment when he changed his hair shampoo, then all the allergic reactions kind of like subsided. So do not underestimate the product that we used. Then next, maybe we can go to the next questions. Is there any hair growth treatment? Yes, there are various hair growth treatments available nowadays depending on the underlying cause of hair loss. Here are some effective options like topical hair care, minoxidil. This topical treatment can be applied directly on the scalp and is FDA approved for both men and women. It can stimulate hair growth and help to slow the hair loss. Secondly, we can talk about oral supplementations to improve the hair growth. Finasteride or Propecia. This is an oral prescription medications primarily used for men, but it's effective, especially for genetically inherited male pattern hair loss. So it works by preventing the conversions of testosterone to DHT, a hormone associated with hair loss. The other treatments options available are like laser treatment, low-level laser therapy, and this therapy uses specific wavelength of light, and it can help to stimulate hair follicles and promote hair growth. Other treatments like we have talked about just now are like platelet-rich plasma, PRP therapy, which involve drawing blood and then getting the concentrated plasma, which is rich with platelet, and then to treat the scalp to promote hair growth. And last but not least, hair transplant surgery for those patients who have severe hair loss or who started late but would like to have a fast recovery. Hair transplant surgery can be an option as well. So next, we can also talk about nutritional supplementations, identify the cause of the underlying cause of hair loss, which could be due to nutrition deficiency, like what we have discussed, zinc, biotin, irons, omega-3, and to have all the supplements can help to support healthy hair growth. And not to forget as well, the last two, hormonal treatment for those people who have hair loss due to hormone imbalance. And the last one would be medical conditions like alopecia areata, and then some conditions like hypothyroidism or hyperthyroidism or autoimmune diseases. And for this type of conditions, it is best to consult with a healthcare practitioner so that to get a proper treatment for that. Then maybe we can go to, there are still quite a number of questions available. Now let's go to video 3. In our clinic, patients always ask, "Doctor, I'm losing hair. Where do I start? Should I take medications or use something topical first?" The answer begins with understanding that each journey is unique. First, we need to identify the cause of your hair loss. It can stem from hormonal changes, nutritional deficiency, stress, or immune-related issues. It's essential to approach treatment thoughtfully. Without pinpointing the root causes, the results can often be disappointing. In our clinic, we take the following systemic approach. First, we personalize the consultations. We delve into your history. How long have you been noticed changes? Is there a family history of hair loss? Then, we have comprehensive scalp examinations. Assessing your scalp allows us to identify thinning area, inflammations, or scalings that may indicate underlying issues. Third, blood tests. We will perform blood tests. We check ferritin level, vitamin D3 levels, and other hormone levels as well. If we suspect autoimmune or nutritional deficiency, further testing may be necessary. Number 4, genetic testing. Utilizing tools like the tricho test, we can determine if your hair loss has a hereditary component. This helps us tailor medications that may work best for you. Once we identify the cause of your hair loss, we can move forward with treatment. Treatment typically encompasses several layers. Lifestyle changes, which embrace a balanced diet rich in protein from sources like eggs, fish, and beans. Consider iron, zinc, and vitamin D3 supplements. Establish regular sleep patterns. Reduce stress level and avoid smoking or excessive alcohol consumption. These foundational changes will nourish healthy hair follicle. Second, medical treatments. Minoxidil. This is the only FDA-approved topical medication suitable for both men and women, stimulating hair follicles and prolonging the growth phase. Finasteride, which is an oral prescription for men. This works to block DHT and slow follicle miniaturization. Spironolactone, which is recommended for women, especially those experiencing hormonal imbalance like PCOS. Nutritional and hormonal support. Protein supplements and vitamin can boost follicle health. Women facing menopause or thyroid challenges may also benefit from hormonal balancing. Clinical procedure. PRP or platelet-rich plasma. This involves injecting your processed blood plasma into your scalp to stimulate growth. Low-level laser therapy. This can also aid in follicle stimulations. Hair transplant surgery. This involves relocating hair follicles from denser hair area to thinning regions of your scalp. Remember, hair loss treatment is never one size fits all. Each plan is customized to address your specific needs and conditions. Early detections can lead to positive outcome with the right care and intervention. Welcome back! If you have any questions, feel free to leave them in the comments below. I'll do my best to answer each one of them. And for 5 lucky viewers, we'll prepare a special gift, complete essential kits. What's inside this amazing kit? NMN, which will help to boost energy and support cell repair. Collagen Forte, which will help to improve skin elasticity and radiance from within. Plant Pro Plus, which will help to enhance gut health, daily nutrition restorations, and overall wellness. It's a simple way to help you look better, feel stronger, and glow with confidence from the inside out. So, don't be shy. Drop your questions about hair loss in the comment below. We'll be announcing the winner tomorrow on the Anna Hu channel Facebook page. So remember to like and follow us. Let's talk about some treatment options for hair loss. To treat hair loss effectively, the first step is always to identify the root cause. In the clinic, we usually start with a few key assessments. First, we'll take a detailed medical history to understand when the hair loss started, whether there's any family history, and if you have recently gone through major stress, illness, or nutritional deficiency. Next, we'll examine the scalp conditions, checking which area are thinning, whether the hair has become finer and weaker, and if there are any signs of inflammation, dandruff, or scarring. Sometimes we'll also run blood tests such as ferritin level, vitamin D3 level, thyroid functions, and androgen level, since all these factors can directly affect hair follicles' health. And finally, there's a more advanced option, genetic testing, like tricho test. This test can identify whether you have a genetic predisposition to hair loss and how well your body may respond to different types of medications. With that information, doctor can then create a personalized, targeted treatment plan that works best for you. Many people ask, can hair loss really be treated? The answer is, in most cases, yes. It can be improved. But how effective it is depends on the cause of the hair loss and how early you start treatment. The earlier you detect and address it, the better the results. Number 1, lifestyle adjustment first. We often start with lifestyle changes. For example, like eat a balanced diet which is rich in protein such as egg, fish, beans, and nuts. Ensure adequate intake of iron, zinc, vitamin D, and B vitamins. Maintain a regular sleep schedule. Avoid staying up late. Reduce stress and quit smoking and alcohol. These simple habits have a big impact on scalp and hair follicle health. Second, daily care. Use gentle shampoo. Avoid frequent perming, dyeing, or excessive pulling of hair. Gentle scalp massage can improve blood circulations to the hair follicle. Number 3, medications if hair loss is significant. Medications may be needed. For example, minoxidil, the only FDA-approved topical treatments for both men and women. It stimulates follicles and prolongs hair growth, must be used in long term or hair may fall out again. Finasteride for male patients only, which is an oral medication that inhibit DHT formations, which slowing follicle shrinkage. Spironolactone for women, especially for those with polycystic ovarian syndrome or high androgens level. Low-dose oral minoxidil. These were increasingly used by both men and women. Effective in some cases but off-label and required medical supervisions. Number 4, clinical procedure. If medications alone not enough or not fast enough, there are medical treatments available nowadays. For example, PRP, platelet-rich plasma, which will use your own concentrated platelet injected into the scalp to stimulate follicles. Mesotherapy, scalp nutrition injections, which will deliver growth factor or nutrients directly to the scalp to revive the hair follicle. Low-level laser therapy, which uses light energy to stimulate the follicles. Hair transplant surgery, for follicles that are completely dead, transplanting healthy follicle is the most effective solutions. In short, there are many treatment options, from lifestyle changes and medications to advanced clinical procedure. The key is to identify the real causes first, then work with the doctor to choose the best solutions for you. Let's start answering the audience questions. Question 1. I've heard of finasteride, but I'm worried it causes erectile dysfunction. Is that true? This is a very common and important question, especially for men. Finasteride works by inhibiting an enzyme called 5-alpha reductase, which reduces the productions of DHT, protecting the hair follicles. It's effective for hair, but because DHT also affects sexual function, some men worried about side effect. Clinical studies shows that a small percentage of men, about 1 to 3%, may experience lower libido, erectile dysfunctions, or reduced ejaculation volume while taking finasteride. The good news is that most of these side effects are reversible after stopping the medications. What I would suggest, always consult a doctor before starting finasteride. Monitor your health regularly during treatment. If side effects occur, dosage can be adjusted, or alternative like dutasteride, low-dose oral minoxidil, or combinations therapy with PRP can be considered. In short, finasteride does not automatically cause erectile dysfunction. Only a small portion of men experience this, and it's usually reversible. The key is safe use under medical supervisions. Questions 2. Do anti-hair loss shampoo and tonic really works? Product containing caffeine, ginseng, etc. What can they actually do? How do they compare to minoxidil? Again, this is another very common question. Anti-hair loss shampoo and hair tonic usually contain ingredients like caffeine, ginseng, peppermint, or plant extract. They can improve scalp blood circulation, reduce oil building, provide a refreshing feeling, make hair appear stronger and less prone to breakage. However, their effect is mainly supportive care. Think of them as preparing a healthy environment for hair growth. They help maintaining hair and scalp health, but they cannot treat the hair loss. Minoxidil, on the other hand, is the only FDA-approved topical treatment, proven to effectively treat androgenic hair loss. Its mechanisms are like directly stimulate hair follicle, prolong the hair growth phase, help fine thin hair become thicker and stronger. In short, shampoo and tonic, we can use it as day care and maintenance. Minoxidil are medical treatments to actively reverse hair loss. Practical takeaway: if your goal is scalp health and shine, shampoo and tonic help. But if you already have significant hair loss, receding hairline, or thinning on top, you need minoxidil or other medical interventions for real improvement. Next questions: do I have to see a doctor to treat hair loss? Hair salon also offer scalp treatment. How are they different from medical treatments? This is again a very common misunderstanding. Many people think hair loss is just a scalp problem, so going to a salon for cleaning, massage or treatment will solve it. That's not true. Hair salon treatments mainly clean the scalp, reduce excess oil, promote blood circulation. These do improve the scalp environment, but the effect is surface level and mentally supportive care. The real causes of hair loss are often internal. DHT, which is androgen hormone effect, or genetic predispositions, thyroid disorder, nutritional deficiencies, autoimmune issues. These cannot be solved by washing or massaging the scalp alone. Medical grade treatments are different. A doctor or healthcare practitioner will conduct a detailed evaluations including blood tests and sometimes genetic testing to find the actual cause of hair loss. Prescribe treatments based on underlying cause such as medications like minoxidil, finasteride or spironolactone. Perform treatments, platelet-rich plasma (PRP), nutritional supplementation support, or suggest for hair transplant surgery if needed. In short, salon treatment provides surface care for shiny, glowy hair, make the scalp more comfortable. Medical treatments are more targeted therapy to address the root cause of hair loss. If hair loss is temporary, for example, due to stress or poor lifestyle, salon treatment may help. However, if it's androgenic or chronic inflammations, doctor or healthcare practitioner intervention is necessary to truly control and improve the condition. Next questions. I see many people trying anti-hair loss shampoo, supplements or treatments, but their hair still doesn't grow. Why do most hair loss treatments fail? Wow, this is a very important question and many people wonder the same. The reasons are: number one, we might not addressing the real cause. Hair loss isn't caused by just one factor. It could be DHT effects or nutritional deficiency, or because of thyroid issues or autoimmune problem. If you try random treatments without checking the cause, you won't see result. It's like a car with a broken engine. You keep changing the tire, but the car won't run. Number two, expecting results too quickly. Hair grown in cycles. From new hair growth to visible hair can take 3 to 6 months. Some people give up after 1 month of treatments, thinking it doesn't work. It's like planting a seed. You can't expect it to bloom tomorrow. Number three, using the wrong treatment. Many people rely only on shampoos or scalp treatments, ignoring medications or medical therapy. Shampoos and tonic maintain scalp health but cannot stimulate hair follicles like minoxidils, finasterides or PRP can. So the key takeaway: identify the cause, choose the right treatment, and be patient with the hair growth cycle. Number four, hair follicles are already dead. If treatment is delayed too long, the follicles can shrink completely and get sealed by DHT, and no amount of nutrition or medications can regrow hair. At this stage, the only effective solution is a hair transplant. This explains why many people feel treatment don't work. Often, it's because the wrong approach was taken, they didn't persist long enough, the follicles have already passed their optimum period. Hair loss doesn't happen overnight, and treatment doesn't work overnight either. The key is to identify the cause, start treatment early, and be patient and consistent. Okay, now let's come back. So I'd like to answer these questions from Sophia. So, is it normal to have more hair fall when washing the hair? Yes, it is relatively normal to lose more hair when washing your hair. So on average, it is common to lose about 50 to 100 hairs a day due to the natural hair growth cycle. So when you wash your hair, especially if you are using shampoo and conditioner, the process can loosen hairs that are already in the shedding phase. However, if you notice a significant increase in hair loss when washing, or if you are experiencing thinning hair or balding patches, it may be a sign of an underlying issues that needs to be addressed. So factor contributing to increased hair loss can be include like hair care product, which we have discussed before just now, harsh shampoos, or sensitivity to the active ingredients in the shampoos and conditioners, or other hairstyling product, because they can damage the hair and the scalp, and sometimes which contributing to the hair loss. So hair washing technique can be one of the reasons as well. Vigorous scrubbing or rough towel drying can lead to breakage as well. With the underlying health issue, conditions such as hormonal imbalance, nutritional deficiency, stress, or medical condition, as we have discussed before, it could be the reason for the hair loss. So it might be beneficial to consult a healthcare provider or practitioners if you think that the hair loss is alarming and you would like to get to know more about it. Okay, then we can go to another question from Sophia as well. Is tying hair cause hair loss? Oh, from the video, you know the answer is yes. So frequently tying hair tightly can contribute to hair fall. So this is often referred to as traction alopecia, which is a type of hair loss that can occur when hair is pulled too tightly. So most of the time the hair will be pulling towards the back. So what the patients normally notice is there will be receding, constantly receding hairline, or the hairline is getting higher and higher, which the tightness itself can cause a strain on the hair follicle. So over time, this can lead to thinning hair, and usually is at the front part of the hairline. So to minimize the risk for hair fall, and there are a few tips. Number one, try to use slightly loose hairstyle. So opt for looser styles, then don't pull your hair too much, especially during exercise. And you can constantly change different hairstyle, and then change partitions on the scalp as well. So regular change the hairstyle can give a hair and the scalp a break. And another thing is we can limit tension. Avoid styles that require excessive tensions or pulling, especially when the hair is wet, or like what I mentioned just now, or during exercise. Try to use gentle accessories as well. Use soft hair ties and accessories that don't snag or break the hair. Then we can go to the next questions from Brian Ma. Is hair loss shampoo work? Okay. So hair loss shampoo can be beneficial for some individuals, but their effectiveness varies depending on the ingredient used, or what we call as the active ingredient used, and the underlying cause of hair loss. And for example, when we are talking about active ingredients, many hair loss shampoo contain active ingredients like biotin, saw palmetto, caffeine, and some even contain like antifungal medicines like ketoconazole, which may promote healthy scalp, and with the aim to reduce the scalp inflammations, and all this will, or some active ingredients which will help to block the hormone that contributes to hair loss, like the DHT. So the other reasons, like for the reason why the hair shampoo can lead to hair loss, it could be because of the some of the solvent, or some of the what we call as the medicines which used to prevent the to elongate the expiry date of the product itself. So some patients, they might have sensitivity to or allergic reaction towards it. Okay, so a clean scalp is crucial for the hair growth. So hair loss shampoo can help remove excess oil, dirt, and building up, which may inhibit the hair growth or to clog the hair follicles. So some of the hair shampoo, they might contain moisturizer and some nourishing nutrients as well, with the aim to hydrate and to nourish the scalp and hair. However, all these are very individual dependent, or we need personalizations as well. If you're trying out a new hair um, loss shampoo, or the shampoo to promote hair growth, you try it out and then you monitor your scalp conditions and your scalp health, and then you can adjust from there onwards. Then maybe we can look for another questions maybe. So another questions from Brian Ma as well. So why am I losing so much hair suddenly? So experiencing significant hair loss can occur for various reasons, and it's important to determine the underlying cause to address it effectively. Here are some common factors that can contribute to hair loss. So the commonest cause for sudden hair loss, number one, is lack of sleep. So if continuously for the past, like maybe 5-6 days, you are only getting 3 to 4 hours sleep, so up to a certain extent of what your body can tolerate. So one of the sign that body giving up to the body try to give us as a signal that it's under stress, or it's already exceeding what it can handle, is to have hair loss. So besides that, another reasons for which is common for hair loss in male are because of stress-induced sleep, stress. These two is the commonest cause. Other causes are like genetically inherited or hormonal change for male patients, like getting quick shots of testosterone injections, where the patients are having genes where they have male pattern baldness. The other commonest cause for sudden or acute hair loss is medical conditions like thyroid disorder, autoimmune diseases, scalp dermatitis, scalp infection. All this can cause hair loss as well. Nutritional deficiency in the other end, usually it will not cause sudden hair loss. Nutritional deficiency, usually it will come in a way, in a very gradual manner. Another commonest cause is when the patient's trying out on a new hair care product, and the harshness in the hair care product, or because of sensitivity or reactions towards the hair care product, can be one of the reasons why the patients have a sudden acute hair loss as well. The other potential cause are medications induced. Certain medications like medicines for arthritis, depressions, for heart problem, or medications for high blood pressure, sometimes they might induce hair loss as well. So you might want to recheck again for the past few days to few weeks. Is there any changes in your lifestyle? So if you're concerned about the amount of hair loss you are losing, it would be best to consult a healthcare professional. They can assess the situations and then conduct any necessary tests and recommend appropriate treatments or lifestyle changes for you. Okay, I think that's all for today. Thank you everyone for joining our Facebook Live today. We really appreciate your time, your questions, and your support. If you found today's sessions helpful, remember to follow and subscribe to our Anahu channel for more medical insights and health tips. Not to forget the beauty tips as well. So stay healthy, stay informed, and we will see you in the next sessions. Good night and take care. Bye.